Hi, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators Podcast.
This is the month of March, and we are going to be focusing on some common Medicare mistakes that we hear folks asking about us a lot. And we kind of feel like it's our job to help you guys navigate these things so they never even become an issue for you. And Elliott, you're talking to people all day, every day about these things. One of the first things I wanted to ask you about, Elliott, was the Part B late enrollment penalty. Is that something that you feel like people struggle with? Do you have an example or a story of someone struggling with that? And how do we not face that problem?
Yeah, that's a very good question because guess what? Not too long ago, I got off the phone with a client. I've been working with this client for they're going to become a client eventually. But we've been working together for probably 6 to 9 months now. And we kind of knew she was going to have some issues because here's what happens is when people have insurance through their employers, most of the time, most insurance meets the requirement where people can delay their Medicare Part B until they retire, right? They're still working, they've got insurance through their employer, and they don't need Medicare yet. They're happy with their insurance already. But what happens when the time comes for you to activate your Part B, in order to avoid those penalties, you need to go back to your employer and have them sign off on a document. It's called a request for employment information form. Your employer will put the dates that you were employed, the dates that you had coverage, health insurance coverage through the employer. If your spouse was covered, they'll complete one for your spouse. Well, I had a client who has been, since her husband turned 65, her husband's been covered under her insurance, but she has been with 3 or 4 different employers since her husband turned 65. And one of her employers doesn't even exist anymore.
Whoa.
So when I talked to her for the first time, we kind of went through that. We kind of described, yeah, you know what? You've got to go for your husband. She's just turning 65, so she has no problem applying for Medicare because she's going to retire and she's switching over now. But for her husband, since her husband's been delaying Medicare for 6 years now, she has to go back to each one of those employers and get this document signed off. And it sounded like there's been buyouts. Some of her companies don't even exist anymore. Now they're under a bigger umbrella company. So we just knew this was going to be an issue, and she's been struggling to figure out who to go to, who to contact to go back and get this verification form signed off by all these past employers, because basically she needs to show proof for her husband that he has not had a lapse of over, might be 8 months, but basically she needs to go back, and she's been able to do it just this week, or within the last couple of weeks. I think maybe 3 or 4 weeks ago, she finally got all the documents that her husband needed. They got them into Social Security, and it's still processing. So we're kind of seeing how things are going to play out. But that's the length of what could happen. That's kind of worst case scenario for somebody if they've been with multiple employers and there's been, mergers and acquisitions with their previous employers. It can be very challenging. A lot of times people just have one employer and they can just go back to that one employer and have them sign off on it, and perfect. You get to enroll into Part B penalty free. If not, there's a 10% penalty for every year you go without Part B. So for some individuals out there who just said, no, I don't really care for Medicare and I don't have any insurance through my employer. Well, once you do activate your Medicare Part B, there's a 10% penalty for every 12 months. So we're trying to avoid that for that client, but we'll kind of have to see if they were able to get all the documents in that Social Security needs. So it can be a simple process, but it can be more tricky if
Wow.
employers. Yeah.
So she was working. He had already turned 65.
Yes.
And he had been 65. Did you say 6 years?
Yeah, I think he's 72 now.
Okay, and she's about to turn 65.
Right,
So she's about to get off of her employer group coverage.
right.
So she had to go. Over the span of 6 years, she's had how many different employers?
I think 4, including her current employer.
Ooh, that's a big project.
Yeah. So for herself, it's not, if it was just her, since she's turning 65, she wouldn't have to go back to any employer if you're applying when you're turning 65. But since she's been covering her husband for the last 6 or 7 years, she needs to go back to her current employer and her 3 previous employers.
Whoa,
Yeah.
since he turned 65. Okay.
Yeah. Yeah.
I had never thought through a scenario like that before because I always think about an individual
Yeah.
who decides to stay working and stay on their employer coverage, but I
Yeah.
didn't think about someone who was covering a spouse who had already
Yeah.
turned 65. That's
Yeah.
fascinating.
Yeah.
And like what? So the Part B premium is the monthly fee that you pay, not the deductible. The deductible is the amount you have to meet in order for the coverage to kick in, but the
Right.
premium is the monthly payment, right? Okay.
Yeah. So premium is what you have to pay upfront every month just to be enrolled into Part B.
Okay.
Okay. And then when you actually use the insurance, that's where all those insurance terms come in, deductibles and co-payments and co-insurance. So the premium is just to get you in the door. And then
Okay.
once you're in the door, then the doctors have obviously their own charges, and Medicare Part B has a deductible of $240 this year. So that's kind of how that works.
Okay. So to avoid this Part B late enrollment penalty, what's the time period that you need to enroll in Medicare traditionally?
Yeah, so if you have delayed Part B, Social Security gives folks 8 months from the end of their employment. Okay, so from the last month or date they were actively working or employed. So as long as that person goes to apply for Part B within 8 months, they shouldn't have a penalty. But here's the thing: is within that 8 months, Medicare is supposed to be their primary insurance. So if they need to go to the doctor or see a specialist, or need a procedure, because here's what happens. Have you heard of COBRA, or do you know what COBRA is, Becky?
I was going to ask you about that because I have done some research on this. I don't totally understand what COBRA is. I have heard of it, and I know that there's an issue with HR managers not explaining this well to their employees. So explain that transition from COBRA to Medicare. What are we missing here?
Yeah. So COBRA, basically what COBRA is, when your employment ends, you can continue your insurance program, but you usually have to pay the full price. So if somebody retired or were let go, or switched jobs, usually they get sent out COBRA information. COBRA is kind of like a protection for people to be able to continue their insurance. If something happens, if a life event happens, and you've got to quit your job, or you're let go, COBRA allows you to continue your insurance for up to 18 months. So what happens, how it relates to Medicare, is a lot of people who are 65 or older think, oh, I'll just use COBRA. It might be a little bit more expensive, but I'll go on to COBRA once I retire. Well, what happens is COBRA at best, if you're eligible for Medicare, is secondary. Your Medicare is supposed to be primary. So even if that person waits 8 months to apply for Part B, let's say they pick up COBRA, they don't apply for Part B yet because they know they've got 8 months to apply penalty free. Well, if they go to the doctor or go get a procedure done, I believe COBRA can come back and say, hey, we're not going to pay for this outpatient procedure until Medicare Part B pays.
But if you haven't enrolled in Part B,
you see where the problem comes in?
Then there's a problem.
That's a huge problem. So, and we've seen this actually happen where people have been stuck with bills because they didn't apply for Medicare right away, and their COBRA came back and said, hey, we're secondary. We're not paying till the primary pays. And if you don't have your Medicare all in place, that can be a huge issue. Obviously, if you don't go to the doctor in that 8 months, you're fine. Nothing happens. But if something like that were to occur, that's where folks can get into trouble. So it's really important to start up your Part B of Medicare, B as in Bravo, as soon as your insurance as an active employee is set to come to an end.
Okay.
So you have no lapse. That's the best way to, in my opinion, that's the best way to do it.
And if you happen to be an HR manager and you're listening right now, please tell your employees that are turning 65, if they're going off Medicare, what would you have the HR managers tell people?
I would have them call Social Security.
Have them call Social Security.
Yeah, ultimately that's the arbiter here that kind of sets the rules and will advise individuals on Part B and what should be done. I've got my take on it. Of course, I'm not the official Social Security Administration. I don't work for them. I don't get paid by them. I don't have any relationship. We just kind of understand how they work, enough to, give some pointers on what to do. But HR managers, for legal purposes, you probably just want to direct people to Social Security. Have Social Security be the ultimate, because they're the ones that are going to approve Part B of Medicare and give information based on a person's situation for Medicare. But that's my understanding of it.
Okay, sounds good.
Yeah.
That is super helpful. And I feel like that's probably a common mistake that people make with Medicare, that either they wait too long to enroll and then they're stuck with that Part B late enrollment penalty. They don't enroll in their initial enrollment period. They wait and then they're stuck with that. Or when they delay Part B because they're still under their employer's group coverage, they don't understand how that transition works.
Right.
So,
right. Yeah. And another little nuance to it is sometimes employers will help pay for COBRA, which makes it a lot more attractive to just do COBRA. And so people think, well, my company's going to pay for COBRA for 6 months. Why do I need Medicare Part B? Why do I need to start paying for Medicare Part B if I've got COBRA that's paid for the next 6 months? Well, just don't go to the doctor, right? I mean, because you need Part B first as Medicare's primary. Okay, even if your COBRA is paid for, that's great, but I would still suggest getting Part B. So it just adds another. It changes the incentive structure for people, and sometimes people, based on that incentive, people can get themselves into trouble that way because that's more reason for them not to apply. They think that's more reason for them not to activate Part B right away.
Yep.
So,
that makes total sense.
Yeah.
If you think you're not having to pay for insurance for a little while, I mean, that's very attractive.
Why not take advantage of that? But there's a potential downside to that for sure.
Okay, good to know.
Thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.